Aloha and welcome to the Kupuna Connections program. I am Cullen Hayashida of Kapi'olani Community College, and with me is Tony Hathaway, Education Coordinator, and we are both the co-hosts of this broadcast. Kupuna Connections is a locally produced TV series broadcasting that is dedicated to seniors and family caregivers. Each week we invite guests to speak on various topics dealing with senior and long-term care related issues. And you tell us what you'd like to learn about, and we will find the local experts for you. And today we are very fortunate to have as our guest Bonnie Castengay, who is with a case management agency, Ho'okele Personal Health Planners, and she will be talking about case management for seniors. So welcome, Bonnie.
Thank you
Let
very
me
much.
first of all ask you to say a little bit about yourself.
Thank you for the invitation, and I'm glad to be here.
Great.
My background is a registered nurse. I've been an intensive care nurse actively, and after that, many years in administration with hospitals in patient safety and quality and case management. About 3.5 years ago, two other individuals and myself founded this company called Ho'okele Personal Health Planners. We saw many of the needs of families as we were working through the hospital system as to how difficult it can be. And so we opened this company to help them.
That's great.
Yeah.
Okay. Let me have Tony share a little bit about herself as well.
I'm Tony Hathaway, and I'm a social worker, and I work with Cullen at the Kupuna Education Center at Kapi'olani Community College, and I coordinate a lot of our education programs for seniors and their family caregivers, and we also have training for home care workers. So let's just get started with something fairly simple. I hear the term case management a lot. Just what is case management?
You know, it takes many different forms, but basically the essence of it is that it's a holistic approach to individuals and their families in doing a comprehensive assessment so that we know what their needs and preferences are, so that at that point we can go ahead and personalize the planning for them and a service plan and delivery of that service plan to individuals. It's actually what I call connecting the dots. Many times it's very difficult for families to figure out what the next steps are and who to communicate with. And so through that coordination and communication, we're able to manage the details for families and take off that stress that sometimes is very difficult because of the silos in the healthcare industry and the alphabet soup that individuals will face.
Right.
You know, oftentimes we have people say, well, I know what nursing is. And I think I understand what doctors do, right? Or what a physical therapist is. But case management, that's a little bit different, you know? And that's where they get a bit confused. Yeah?
Correct, yes. But it's someone at your side who's pretty much objective, so it's outside of the health system, looking out for you and the individual. So it's advocacy. It's being the communicator with the family, so a family liaison. And you know, connecting them to the linkages of the resources and giving them that information so that they can make informed decisions for themselves and their family.
I think one of the good examples of this is, you know, when I look at, we have in City and County of Honolulu, a senior handbook, and there's something like about 300 agencies listed in there. So for a family to figure out which agency should you use, or which one is appropriate, or which one is best for my mom or dad, that's pretty difficult, I suppose.
It's like going through the yellow pages and going down and saying, okay, who do I pick for a doctor?
Right.
It's just a maze.
Yeah.
And
Right.
so
That's where case management.
That's correct. Because of their experience, they can connect you. They'll know your preferences and your needs, and so they'll try to match those resources for you.
Now, do you folks specialize in case management for elders and their families?
We do elders and also those with acute illnesses or disabilities.
Okay.
And many case managers will do varied segments of that. Some will do care home case management, others will do foster home case management, but most of us will do community plus maybe the care home or foster home.
You know, one of the things I guess I wanted to ask was that, you know, this service is now being mentioned more and more now, and, you know, now we're hearing this word, and it seems like a new trend. Now, are needs changing?
I think what's happening is the population, and we're seeing the aging tsunami is what it's being called now.
Right.
And so
we have some slides that
Slides
you
on here.
shared with us, and perhaps we can see this.
and you can see the tidal wave that's occurring. So this is the population over the span of years of seniors aging in homes, in independent living.
Living alone.
Living alone. And so what you can see is probably in 2009, 2010, we're at 10.5 million. That's going to double by the time 2030 occurs.
In 20 years.
Yep. And so, and that's part of us. So we're going to be part of that.
Yeah, absolutely.
Yeah.
Yeah, yeah.
And so the resources that are needed, the availability of resources is what's going to be tighter.
Tighter.
And so
well, we have a couple more slides. I
Yes.
thought you might want to,
Okay.
we may be able to share with people. This increased life expectancy and increase in care needs. We've got this gentleman in a nursing home or a hospital bed that is all filled, you know, I mean, has all tubes in him, and he's 162 years old,
right.
and is going to having a birthday in his hospital room. There's a huge question as far as how are we going to be able to provide care for this growing population.
Exactly. And because of medical technology, people are able to live longer. So, you know, 85, I mean, you see spry 70-year-olds, you know, going into their 90s. It's amazing.
Yeah. Take a look at this other slide here. Here we have a doctor talking to a patient, basically saying that your Medicare coverage is way down, but you know, it's time for you to go home, you know. And so you have patients leaving hospitals quicker and sicker.
And
So I guess then the demand for services in home, like what you're talking about,
increases. Because of the reimbursements and how they are in the hospitals, hospitals will see patients up to the point of their doors, but then once they get into the community, they become lost, and they're not able to triage the problems, and that's when they start to get readmitted again. And so that's where case management can help to keep them at home safer.
Now, does everyone need a case manager, and how do you know when you need one?
Well, you know, I think it's determinant on whether you have support systems around you that are available to help. And if they are, then we try to have them make use of that. But a case manager, when caregiver stress occurs, when they don't know what to do, and a lot of times it's during the crises that they need that extra facilitation and help to maintain them.
I think we have another slide that shows a caregiver in acute distress.
Well, when you're like this,
Yeah.
that's when you need a case manager.
Right.
So if those antidepressants aren't helping, and that's part of the caregiver syndrome. They get to be isolated, they feel isolated, they start to become depressed, basically because everything is around them. They're not able to lead their lives as they usually do. They can't go out anymore. And this is when respite help is occurring. Sometimes it's just a little bit of help that'll get them through. And that's where
I guess another situation that comes to mind, and this happens here in Hawaii especially, is long-distance caregiving. Families, you know, an elder may not have anyone here to take care of them. So how might a case manager help in that kind of situation?
Well, and that's where I think the essence of case management can be of assistance. And I think that was one of the reasons why, you know, we looked at this type of business, is because we send our children off to the mainland for college. And lots of times they don't come home, and that's where the elders are here, and they're aging, and it's difficult to manage over the long distance. And so trying to connect with people, trying to talk to doctors, trying to find the resources becomes very difficult for the adult child who's on the mainland. So in this instance, we can be the ones on ground, knowing who the community resources are, so case managers can find those resources and communicate, though leaving the decision-making to the family member, but just providing the options and the alternatives for them is very helpful.
Right.
And then monitoring the parent in the home setting or wherever they may be to make sure that things are going well and identifying early warning signs so that you can go ahead and intervene so that they remain as independent as possible.
So oftentimes families, they can maybe fly in for a week or maybe two and try to do what they can for the person. But then you folks can really take over from that point and continue to monitor
Correct.
and then let them know how
Correct.
the person's doing.
Correct. Many times we'll set up weekly conferences, initially at least, so that everyone's involved, plus the individual themselves. We want self-determination, so they are part of that decision-making if they can be as much as possible, and then keep them attuned to what's happening on ground here. And sometimes you can use different types of technology so that you can have webcams and all of this so that, you can see what's going on, or passive sensors so that people can be alerted to different things. So those are some of the technologies that are available to help with caregiving also.
Great.
Now, what do, excuse me, what do caregivers actually do, if you were to break down their task?
If we had caregivers, you mean
No,
the
I'm
family
sorry,
care?
I'm talking about case managers.
Oh, okay.
What kind of work do they do? I mean, if you were to break the task down step by step.
Step by step.
what are some
Initially,
of
the
things?
first step would be an assessment.
Okay.
It'd be a comprehensive assessment.
And what would that entail?
That would entail what are the clinical needs of the individual, what are the how are they functioning, how independent are they, can they do their activities of daily living, can they manage their finances, can they cook, can they shop, what are the deficits there, and trying to identify that. Other thing is who are the family members in the support group around them, can we tap into those? And then what are their preferences? What did they do in their past life? What were their likes and dislikes? And so that what you can do is customize that type of caregiving. For instance, many times, you can have them at home, but in front of the television set does not work. So they go downhill much faster. So what type of activities can you put into the home or send them to that would meet their preferences and needs? Sometimes it's a day center, sometimes it's a senior center, or sometimes it's just an activity at home. Someone who enjoyed golfing, videos of golfing, but talking about that so there's brain stimulation going on. So that's part of the uniqueness of case management, I think, is you get to really know the family
So
and the individual.
you do an assessment.
And then you start to plan.
And come up with a plan.
You develop a service plan with alternatives. So you're posing that, and you're giving them options. We
Some
can do this
choices.
as choices, and what are the costs of each of these choices? Sometimes they're looking at, should we look at placement at this point in time, and what does that mean? What are the different levels of placement, and what does mom or dad fit in at this point in time? What are the costs? If I keep mom or dad at home, what would that entail? And so you see those options, make that decision, and then implement the service plan as agreed upon. And then once implemented, you bring in the resources, the linkages, safety features such as, Kupuna monitoring, so that they have emergency calls, or lifeline, medication dispensers, pill boxes if that's a med compliance. So all of those types of resources into the home setting. And then what you do is you monitor. So you're monitoring it. You're seeing, is this effective? If we're placing caregivers into the home, what's that schedule? Who are those caregivers and what will they do? So that is integrated into the plan. And then you're monitoring how they're doing and progressing. Many times it's going to the doctors with them because the case manager sees the individual in their home setting, knows what the family dynamics are, and is able to give much more in-depth information. And because many of them are medical, they can talk the same language.
Do you find that sometimes maybe the plan doesn't quite work out
Yep.
and you got to adjust
You have to tweak it. We're always tweaking it.
You're always tweaking.
And we always tell the family, once we're putting in services, the first 2 weeks is where you're going to figure out if it's working or not. It's very difficult. If you're putting caregivers in, sometimes it takes 3 weeks to figure out, is this the right one? Is this the right fit?
And so monitoring isn't just phone calls.
Nope,
It's
it's
going to the
visually
home
and seeing-
seeing
yeah,
how they're
yeah.
doing.
Many times we have seniors who are pretty healthy, but looking in on them, how they're groomed, you can start to see the changes. They're not as groomed as well. The house is not as well taken care of. You look in the refrigerator and there's really no food there. Then you sort of know that the downhill slide is occurring. So what other resources do I need to put in?
Now, case management, this is something a family member can do?
Family members can do that.
Okay.
If they have enough resources and backup, then yes. What we recommend is that, do you have respite time? Do you have time for yourself to do what you need to do? You cannot do it 24/7. But many times it falls on one individual family member, and that becomes difficult. So what we'll work in is, if you're going to do this, what other supports do you have? Church members, family support, community support outside that you can tap into, or do you hire someone to come into
I
the
guess
home?
also to having a professional case manager allows you to take advantage of the vast resource of knowledge and experience that you had in terms of what works and doesn't work,
Yes,
right?
yes. Many of us are either social workers or nurses, and that way we know the profession and we know what's out in the
Right.
community. And then also we're learning as we go along that this works for certain individuals, and so you pull that into your tool chest and you
Right.
go, oh yeah, and that resource worked well. This resource is great for grab bars, and so you start to learn your
Build
own.
that.
You build
Yeah.
that database
Yeah.
of
Yeah.
yourself.
I guess
right?
that's what I tell families is that, you can do this yourself, but it's often very time consuming, and then a case manager just has that expertise, as you were saying. Maybe there are a lot of great adult daycares out there, but you could say, but for your mom, what I know about her, maybe you want to, look at these 2 or 3.
Exactly.
You can narrow it down pretty
Exactly.
quickly.
That's right. That's right. Is it large? Is it noisy? They didn't like that. They liked Hawai'i'ana. They're more Oriental in taste. So, that type of thing.
Right.
Yeah,
Okay.
that's a good point.
Can you give us an example of
Mm-hmm.
of a personal experience that you've had in terms of working with someone?
Yeah, we have. Let's see. You asked me about long distance.
Okay.
One of ours was an elderly couple, wanted to stay at home, did not want any placement. Unfortunately, the husband sustained an injury, so went from the hospital to a skilled nursing facility. Daughter lived on the mainland, and she said, I want him home, but how do I get him home? And how can I do this? And I'm going to be here for only a week. And so what that entailed was an assessment of the home setting, beyond just meeting with the client and the family and knowing what their needs and wants were, and then helping to set up the home for his discharge back, the transition back. So filling in those gaps, knowing what resources to pull in. We have access to other individuals such as physical therapists, whatever. So sometimes you need to tap in on them depending on what the injury is, and then setting up home and the home program, and then helping to transition them back in, implementing those services, the plan as it was, and then monitoring how they're doing. So in this situation, he came home. There were some rough times. He had to go back to the emergency room once. We went along to advocate, then came back, and he was able to stay at home for about 3 years. So, and we communicated with the family. They came in probably quarterly, but we had weekly types of conference calls or email and saying things are going this way. As we're monitoring, you can notice early signs of certain things like a UTI, so intervene very early. We went to doctors. Urinary tract infection, sorry. And then also going to the doctors with them so that we're able to communicate and then communicate back to the family members. So, you have sort of like a safety net.
Right.
Yeah. Yeah.
So that actually involved putting in place some services as well as bringing in some equipment.
And we had private caregivers in place also to help them initially. And as the wife progressed and got accustomed to the care, she was able to wean down off the caregivers. And then what we had left was somebody to help her shop sometimes, and then taking him to the doctors, and we meet them there. So yeah, transport.
Well, I actually think that might be an important point for people to know, is that things do change over time, and I guess that's how the care plan changes also.
Correct.
Is that as things can either improve or they can start declining, and then you'd have to either bring in more services or maybe they'd need less.
Correct. Correct. Yeah. Yeah.
And so how would you find a case manager?
How would you, well, there are associations here in Honolulu. One is the Hawaii Association of Case Managers.
Right.
So, linking into that to find someone, talking to your doctor, talking to individuals. Sometimes if you talk to a lawyer, if you're doing some estate planning, and you say, I need this help, then they will go ahead and help you with that. In fact, that's how this couple found us. The daughter found us through the lawyers that they were working with. So it's talking to other professionals. It's a small network here, and we as case managers will refer to each other depending on what the specializations might be.
What do you look for in a good case manager?
Well, I would say primarily because you're dealing with the elderly, you're looking at an aging process and understanding that and the dynamics. There's psychosocial issues also, so beyond the clinical. So someone who's licensed in either social work or nursing would be good, optimal, if you could do that. They should be a part of one or another of the associations, so you know that they're linked to professional associations and learning from that. We have a movement now with the legislator going forward on case management, so we can provide to the community some consistency, a standard of practice, and also we will be saying that case managers should be certified. So licensed in one of the professions, a clinical profession probably, and certification as you're coming down the line. But many times, case managers will need to have worked several years in the profession before getting certification. So if not, then I'd ask, are you part of an association? Who do you, link with?
I suppose it wouldn't hurt to get some referrals to.
Oh, yeah.
If they could have others that they have provided services for or to.
Yeah,
Make some.
that's right. Hospitals and skilled facilities, care homes have listing of case managers. So, they will need to provide them with alternatives. But again, it's like going down the list and going, well, I don't know who's good or not good.
That's
so
right.
It's talking to friends and people who might have access to this type of service.
So where do you find these associations? I mean, are there some websites, or are there some
There's
booklets?
there's Case Management Society of America, CMSA. Those case managers primarily do insurance and disability, but they're very well versed in that. They also have a component of case managers like ourselves who work with the adult population. And then our own Hawaii Association of Case Managers is another
Okay.
one. So I guess if you Google case manager associations in Hawaii, you'll probably get us.
Well, I think another suggestion would be at the closing of our show, we have a listing of places to call.
Oh, okay. Yeah.
One, of course, is Kupuna Education Center, but the other is the Hawaii Aging and Disability Resource Center.
Sure. Elder Affairs, going there too.
Right, right. So with one number, it is possible to, you can go to their website and actually, regardless of what island you're on, find the resources on your island.
Oh,
yeah,
yeah.
so that one website is up. It's Hawaii ADRC, I believe.
Oh, okay.
Hawaii ADRC
Okay, that's great.
ADRC.com. Yeah. And I think the Elderly Affairs Division phone number, do you recall what that is?
It's going to be on the end of the program.
Okay,
It's
good,
shown
good.
on the screen.
Yeah.
Right.
It's easier to remember that way.
Yeah.
Yes.
Well, I think one of the other things we wanted to find out was about the costs of case management. I think that's a question people often have.
In general, case management is privately paid for. It's not covered by Medicare, HMSA, or Medicaid will cover it if you're in a foster home. And they have case managers on Medicaid that if you're on a Medicaid program and that insurance plan, you'll have a case manager who's assigned to you to help you. But it's only that grouping that would have access to a paid case manager. They'll pay the case management agencies for that. So if you're in a foster home or parent is going to a foster home, then you have to have a case manager assigned to you
Okay.
to oversee that plan.
Can we provide the viewers with maybe some general idea with regards to what case management would cost
You know,
on a private basis?
on the private basis, probably anywhere between maybe $250 to $400
For
a month.
per month? Oh, it's on a monthly basis?
It's on a monthly
Oh,
basis.
that's not
Or there's packages that you
Uh-huh.
can purchase. Sometimes with case management, there are several things. The most successful is that you've worked through the family and the individual improves, and they don't require
They
your
don't need
service,
it.
and that's a success.
Yeah.
The other thing is very short-term case management. They just need the options, alternatives, just to confirm some education, and that's it. Other times, it's recurring.
recurring.
Yeah, and if it's recurring, it's anywhere between $200 to $400.
Okay, okay. All right. Now, how about one last tip for our
a
viewers?
long-term care insurance will cover.
Okay,
Okay.
okay, that's good. Well, we're just about over as far as time is concerned, so perhaps you can tell our viewers just one last tip. If after all of this that they've gotten from you, if there was just one thing that we wanted them to remember, what would that be?
You know, it would be to access someone or a professional early. When you start to see your parents starting to deteriorate or go downhill or need more help, if you call in a professional at that time, you can start what I call the Plan B planning. You can start to take a look at the options and have decisions made. It's like a financial plan. We all have financial plans. We have our wills and all of this. No one ever thinks about health, and they're thinking about it in crises. And when you have a crisis, your decisions are compressed. You have shorter times for decision making, and you may not have all of the options.
Okay. Well, that's about all the
Okay.
time that we have today, and I wanted to thank you, Bonnie Kasengay from Ho'okele Personal Health Planners,
Thank
for
you.
joining us today. And we hope that all of you viewers out there that also joined us today, we wanted to thank you for being with us today as well. And we hope that you'll join us again next week as we talk about other topics of interest to you with regards to seniors and issues with regards to aging in Hawaii. If you have topics of interest and would like to share that with us, please call us or email that to us, and that information is at the end of this show as well. So again, thank you for joining with us today, and I'll see you again next week. Aloha.